Good day. I would like to start the presentation with a reflective question. Have you ever considered the impact of teamwork in a life or death situation? Let's take a moment to reflect. What comes to your mind when you think of effective teamwork in a high-stakes environment? It could be military operations, an airline crew, firefighters, a space exploration mission, professional sports teams, a project manager in construction. Personally, I imagine a surgical team whose effective teamwork made the crucial difference between success and a potential tragedy. My presentation will focus on strategies to optimize interprofessional teamwork in the operating room. We'll uncover the challenges, explore potential solutions, and understand the importance of actionable teamwork practices in the operating room. In the dynamic realm of healthcare, optimizing interprofessional teamwork in the operating room is crucial for patient safety and outcomes. Suboptimal teamwork in the operating room is a contributing factor in a significant proportion of preventable complications for surgical patients. Despite its crucial implications for patient safety, effective teamwork in the operating room has yet to be standardized. Interventions aiming to improve OR teamwork have generated mixed results, as 3. There are a lack of clarity regarding actionable teamwork practices, which remains. Unlike other high-risk industries, such as aviation, recommendations about teamwork for the OR continue to revolve around general principles such as mutual trust or adaptability. Without precise specification of who needs to do what differently, when, where, and how, the development of a shared mental model is challenging at best. This presentation focuses on identifying and implementing actionable teamwork practices to enhance collaboration amongst healthcare professionals in the complex and high-stakes environment of the operating room. Recognizing the need for clarity and specificity, the stance underscores the importance of defining actionable elements using the action, actor, context, target, and time AACTT framework, addressing persistent challenges in intraoperative teamwork practices. The historical origins of the issue can be traced back to the evolution of surgical practices, marked by a transition from individualized approaches to collaborative team-based care. The growing awareness of patient safety in the late 20th and early 21st centuries propelled a shift towards understanding and mitigating systemic and human factors contributing to the surgical errors. Lessons from high-risk industries like aviation underscored the importance of effective communication and coordination in enhancing safety, influencing the adaptation of these principles for healthcare settings. Research studies identifying the correlation between suboptimal teamwork in the OR and preventable complications heightened the emphasis on evidence-based strategies. Institutional changes, training initiatives, and the integration of teamwork standards into regulatory requirements further emphasize the need for concerted efforts to enhance interprofessional collaboration. Consequently, optimizing teamwork in the OR has become a crucial component of improving patient outcomes and safety within the dynamic landscape of modern healthcare. Optimizing interprofessional teamwork in the operating room draws on various relevant theories and discourses. From team steps, human factors, socio-technical systems, high reliability organizing, situated learning, interprofessional education, complex adaptive system and theories, to safety culture discourses, these collectively offer comprehensive perspectives for analyzing, intervening, and continuously improving interprofessional teamwork in the challenging context of the operating room. The issue of optimizing interprofessional teamwork in the operating room is intricately connected to various theories that provide frameworks for understanding, analyzing, and addressing the complexities involved in healthcare teamwork. Team Steps is directly relevant, offering evidence-based strategies to enhance communication and teamwork skills amongst healthcare professionals, aligning with the specific challenges faced in the OR environment. Human factors theory is essential in identifying and mitigating sources of error related to communication, decision-making, and workload. Crew resource management principles, adapted from aviation, contribute by focusing on improving communication, situational awareness, and decision-making within the OR teams. Socio-technical systems theory provides insights into the interaction between social and technical components in the OR, guiding efforts to optimize both aspects for effective teamwork. The application of high reliability organizing principle helps in creating a safety culture, promoting mindfulness and continuous learning. Situated learning theory supports the development of practical teamwork skills through hands-on experiences and simulations, aligning with the dynamic nature of the OR environment. Interprofessional education promotes collaboration, learning amongst healthcare disciplines, fostering effective teamwork. Safety culture discourses in complex adaptive system theories highlight the importance of shared values, beliefs, and adaptability in creating a positive culture and addressing the dynamic nature of the OR environment. These connections highlight how theories offer valuable perspectives and strategies to address the multifaceted challenges of interprofessional teamwork in the OR, ultimately contributing to improve patient safety and outcomes. Teamwork concepts are typically covered to varying degrees in education and training sessions, but less attention has been paid to well-described and actionable behaviors that can facilitate standardized teamwork in clinical everyday practice. Previous studies documented the lack of knowledge of best practices or strategies is one of the most frequently identified barriers to effective teamwork. This may in part explain why there has not been any substantial annual reduction in patient safety events in recent years, despite a proliferation of teamwork interventions. Clearly specifying expected behavior is fundamental to closing evidence practice gaps in healthcare. In implementation science, the Action Actor Context Target Time AACTT framework is an established approach for specifying details of a behavior and enhancing intervention effectiveness as a result. Identifying actionable teamwork strategies for the OR rather than broad intervention that emphasize abstract concepts in a classroom setting is an important first step towards providing clinicians with a common ground from which to approach interprofessional teamwork. This presentation aimed to map the existing teamwork literature according to the AACTT framework to identify actionable practices for use during surgery that could inform future efforts to improve interprofessional teamwork in the OR. A predominant focus on the included studies involved actions specified as a series of steps or tasks listed in intervention bundles or checklists. Notably, the Surgical Patient Safety System checklist, as described by DivRees et al., exemplifies this approach, assigning specific team members responsibilities for distinct items throughout the surgical pathway. The Surgical Safety Checklist outlines various actions during the procedure but lacks precise specification of actors for certain items. In contrast, various studies explored interventions involving specific individual actions rather than multi-step bundles, Examples include closed-loop communication and protocols to minimize distractions, such as the noise reduction intervention described by Wright et al. And the sterile cockpit protocol introduced by West et al. These findings have significant implications for teaching, learning, and practice in the context of optimizing interprofessional teamwork in the operating room. The identified teamwork interventions, particularly communication and distraction protocols, offer actionable practices that could be implemented intraoperatively. Unlike the more complex checklist interventions, these protocols provide specific behavioral specifications, such as closed-loop communication and silencing mobile devices. The implementation of specific teamwork practices, as highlighted by communication and distraction protocols, has the potential to establish effective teamwork as a routine practice in the OR, reducing variability in performance and clarifying roles and responsibilities. These interventions make it clear who needs to do what differently, when, where, and how, addressing the documented differences in perceptions of roles and responsibilities amongst various OR professions. These interventions can facilitate the development of shared mental model, which is a critical attribute of high-performing teams, fostering a mutual comprehension of effective teamwork in an interprofessional team. Despite the widespread use of checklists, such as the surgical safety checklist, the literature suggests that their suboptimal use can negatively impact team functioning. The specificity of communication interventions may offer a more direct route to improving teamwork compared to expecting it as a byproduct of task-related checkboxes. In conclusion, this presentation aimed to shed light on the evolving landscape of interventions for optimizing interprofessional teamwork in the operating room. The identified communication and distraction protocols, with their fewer but more specific behavioral implications, present a promising avenue for establishing effective teamwork as a routine practice in the OR. The distinction between these protocols and the widely used checklists, such as the surgical safety checklist, emphasizes the value of analyzing interventions through the lens of the ACCTT framework. This approach provides a clearer understanding of how interventions should be applied, potentially enhancing their reproducibility and sustained effectiveness. Moving forward, the implementation of teamwork interventions should consider local barriers and enablers, with a focus on tailoring interventions to specific contexts. This provided insights on the ongoing dialogue surrounding the enhancement of intraoperative teamwork, offering valuable implications for teaching, learning, practice, and future research in this field. As we conclude the presentation, I would like to leave you with a vital perspective. How might we better integrate the patient into the heart of our teamwork interventions? Thank you.